I want a 5S so bad because I don't like the way 6s look. But yeah, and I want a gold one too.
I see that one.
Okay, I'll just try to.
She just came over to like.
And then she has the Note 4.
Okay, so let's look at infection then. Forgot to put all these together last year. Okay. This is really one of my favorite chapters, I think, that we do, favorite units that we do all year. And I think that's just, I think it's the most practical for one, or at least for every day, like right now for you guys. But, anyways, it's something that you'll remember. Couple of things. One, tomorrow y'all will watch, we should be able to get through this today, I think. So tomorrow you'll have a book assignment. It's just in those blue textbooks. Let you guys work on that. And then whatever other time, we'll talk about the teaching project here in a few minutes, and then you can work on that too.
What?
The teaching project. Thursday, we'll talk about hand washing. And you guys are actually going to have one of your test grades is to wash your hands. So we'll all go to the teacher's lounge and I'll watch you guys wash your hands. Skills check. So.
Don't you sing your ABCs?
You can. So
you just like, you're going to test on how well you wash your hands? Or?
There's
Okay, my mom's a nerd, so I hope I'll be okay with this.
But I have a procedure that you follow. So. And that's a pretty normal, I mean, that's like my very first week of nursing school. That's what we did. We learned how to wash our hands, and then we did a skills check. So it's not like, that's stuff that we had a whole skills class when that's all it was, all the tests, where they just watched us perform our skills, and we had to meet certain criteria. So kind of nerve-wracking, but we practice. Okay, so signs and symptoms of infection. So what is a pathogen?
It's an airborne disease.
Doesn't have to be airborne.
Or just a disease.
Something that causes disease. Okay, so gen we know means what?
Formation,
the beginning, the origin, something along those lines. And then patho means disease. So it's something that causes disease. Typically bacteria or virus. That's what it could be either. So what's the difference in a bacteria and a virus? Did I talk about that the other day?
A bacteria grows.
Yeah.
It grows, and the virus goes away. The bacteria just continues.
Well,
I don't know.
there's a few other things. One, bacteria are actual living organisms. They can live on their own. That's one thing. One way to think about it. Virus has to have a host. Also, viruses are much smaller than bacteria, generally speaking. They're really tiny, and they can affect your body different ways. Of course, sometimes their symptoms are the same. It's hard to tell if it's a virus or bacteria. Which one's easier to get rid of?
Bacteria.
Usually bacteria. Virus, there's only a few antiviral drugs. And so usually a virus kind of has to run its course in your body. Your body kind of takes care of it on its own, but it takes some time. Whereas a bacteria, what can you get if you get some kind of bacterial infection? What medicine do you get? Antibiotics. They can usually start working, within 24 hours. Now we have, even when you think about the flu, you think of Tamiflu, which is an antiviral, but it doesn't work like bacteria, like an antibiotic that actually kills whatever bacteria it is that, it's working on. I don't know. Usually viruses are a little bit hardier. They can make it through more. They kind of have a shell around them too that's really hard for medications to break through to change, their replication and stuff. So anyway, just interesting thought. Okay, so signs and symptoms of infection. So these occur when pathogens invade a susceptible host. And what were some things that make us more susceptible? Not washing your hands. Do what?
Sharing fluid.
All those things are ways for us to get disease. What actually makes us susceptible? What are some things that weaken the immune system? What are some things that might cause that?
White blood cell count.
Okay,
Not
yeah,
eating healthy.
not eating, not sleeping. I know that you can get sicker not sleeping.
Is that why when you get sick, they say sleep it off?
Probably, and it makes your body, when you're sleeping, your body's still working. So, but just getting enough sleep. If you don't get enough sleep, that can make your immune system weak. Some of the things that specifically that were on the video yesterday, like if you've had a transplant, that usually if people who are on transplants are also on medications that kind of like obliterate their immune system, because otherwise their body
Will fight the
will fight that transplant. It feels like that transplant is a disease because it's something that's foreign, and so our own bodies will attack it. That's why they give them medications that actually make their immune system not work, which also makes them susceptible to other illnesses. Diseases like AIDS, for example, and there's other ones. Any kind of long-term chronic disease, chronic pain can make people more susceptible to illness. All kinds of stuff. Now, for us, we're going to be more likely if you have like an open wound. Okay, that's an easy place, right, for infection to bacteria to move into. If you're sick, like let's say you have a cold, well, your immune system's already fighting off that cold, so you're more susceptible to other illnesses too. It says infection may be present in a localized area or systemic. What do you think that means? Local, what do you think?
like just one area.
Okay, one area, or systemic, kind of all over your body. So, for example, if you, let's look, local signs and symptoms: redness, swelling, tenderness, warmth, drainage. Okay, so let's say you cut your finger and then the next day you wake up and it's red, swollen, oozing, nasty. Okay, that's probably infection. Those are some of the signs of infection. That's a localized infection if it's just like on your finger. Okay, now if you let it stay there and then it starts developing like red streaks down your hand, okay, then it's probably gone systemic and it's gotten in your bloodstream. That's what makes it systemic. Okay? It's affecting more than one area. Systemic symptoms: fever, malaise. Do you know what that means? Kind of like fatigue. It's another word for fatigue, basically. It's just really tired, down, fatigue. Decreased appetite, swollen lymph nodes. That's what they're always checking for when you go to the doctor and they do this. Feeling for swollen lymph nodes. I have a really hard time sometimes telling which ones are lymph nodes and what's just normal. Sometimes you can really feel them, Sometimes they're not as easy. Nosocomial infections. And this is a very specific, special type of infection. We hear a lot about these days. But these are hospital acquired. So what does that mean? You get it when you're already in the hospital. Hospital acquired infection that's unrelated to the current illness. So let's say I go to the hospital to have my knee replaced. So I go in, have my knee surgery, and then a couple days later I've got fever, and they check my blood and I've got a staph infection. Okay? That would be a nosocomial infection. I didn't go in with that infection. I had surgery and then I ended up with it. Does that make sense? That's a nosocomial infection. Not a good thing for a hospital to have a whole lot of nosocomial infection occurrences. It says they're usually transmitted by healthcare workers, equipment, or some other contact within the hospital. So either the people themselves do that, or like it says, the equipment. So the best prevention, you'll see this again, the best prevention anytime for any infection, specifically nosocomial infections, is hand washing. So that's what we'll talk about when you need to wash your hands. We start talking about hand washing Thursday. But every time you walk in a room, you wash your hands. Every time you leave your room, you wash your hands. Every time you walk back in the next room, do it again. Every time you put on gloves, right before you put on gloves, you wash your hands. When you take them off, you wash your hands. There's like a billion times. You just constantly. And that's because, if this person in this room has got a staph infection, the person next to him should not get that. The best way to prevent that is by washing your hands and then wearing the appropriate equipment. Some examples of this are what we call MRSA. Have y'all ever heard of that? MRSA or MRSA. Sometimes you'll hear people say MRSA. It's actually it's a really strong staph infection. Is what it is. Stands for methicillin-resistant Staphylococcus aureus. So it's a staph infection that's actually resistant to a lot of antibiotics, like your normal everyday antibiotics. You can't just take something. You can't just take like an antibiotic that's in oral form, like a pill, and expect it to get rid of MRSA. This is something that you have to go to the hospital and get IV antibiotics for. So you'll hear a lot about it if you go into healthcare, because that's a big, if somebody gets MRSA, it's definitely kind of gives a negative, it has a negative connotation with it. Now, one thing is, when I was in nursing school, MRSA was like a big to-do. If they got MRSA, somebody in the hospital had to have given it to them, and it was a big deal. These days, people have MRSA all the time. It's just because so many people have gotten it, and it's resistant. So when people have taken medications for it, it hasn't worked, and so it just keeps getting stronger. More people have it, even people who haven't necessarily been in the hospital. Another example is vancomycin-resistant enterococci, which is another type of bacteria that's resistant. Vanc, this particular medication that this bacteria is resistant to, is a really, really strong IV medicine. You actually, when somebody has MRSA, the medicine you give them is vancomycin. That's the medicine that they have. It's only available IV. It's so strong, in fact, that whenever the labs that have to be done, every time before they get their medicine, they do a lab to make sure that they don't still have too much of it in their system. And then after they take this medicine, they do another set of blood work to see what the levels are and make sure that they're not too high. So there's a lot going on. Now, after people have been on in a while, they don't have to have that blood work as much once they kind of regulate their dose and figure out what they can and can't handle. But a lot of people are allergic to it. And it actually has to be given over like 2 hours, usually 1 to 2 hours, depending on the person. But they can develop what's called red man syndrome. And literally, like, they're getting their vancomycin and they're just like turn red. All of their skin will turn red if you give it too fast. So they just have to slow it down. So it's a pretty stout medicine. So this bacteria that's resistant to it is really difficult to get rid of. It usually takes months of treatment to get rid of these. So not something that you want to give to someone, and not something that you want to have. That's why if you're the patient, you want to make sure all of the healthcare workers who are coming into your room are washing their hands, because you don't want what someone else has. Okay, asepsis is a term. It literally means without disease-producing microorganisms. Okay, so this is a practice used to make areas free of any kind of microorganism. So we've got two basic types: medical asepsis and surgical asepsis. Okay, medical asepsis is like your everyday clean. Okay, I go into a room, I wash my hands, I put on a new clean pair of gloves, and I can do wound care, whatever I'm supposed to do. That's called clean technique. That's like your everyday, you make sure everything's clean, you go into a room, give them their medicine, that's all. That's called medical asepsis. This reduces the number of microorganisms, so it brings it down. So some examples are hand washing, because your hands can never actually be completely germ-free, because you can't stick them in a microwave oven or something. So, and then other protective equipment, routine cleaning, and so forth. Surgical asepsis, this is what we consider sterile technique. What does that mean? Do it?
It's like sterile, clean.
Yeah. This is like super cool. Yeah, like sterile or surgical asepsis means there's absolutely no microorganisms present at all. None. No good, no bad. We all have a normal amount of good bacteria on our skin too that actually works to get rid of bacteria, bad bacteria that's on our skin and so forth. Same thing in our mouth. We have good bacteria and bad bacteria, but sterile or surgical asepsis means absolutely no microorganisms whatsoever. This is like instruments that they use during surgery. They have gone through this process where they're actually pressurized in an autoclave, and all of the bacteria you get rid of it that way. So when things come packaged, they would say sterile on them. That means there's no microorganisms at all. The OR stands for, it says to remain sterile, only sterile items can come in contact with other sterile items. Okay, so let's say I've got my sterile, say I'm starting, say I'm doing a wound care that has to be sterile, doing wound care that has to be sterile the whole time. Once I open up my sterile instruments and everything here, I can't go back and, go add a glove from the wall and put it on there and then expect it to be sterile too. That actually makes everything else not sterile. So, and I'll show you all that in a second, and it'll make it more sense. But I can't touch anything with my hands because my hands are not going to be sterile at all. I can put sterile gloves on, which we're going to do in a minute, and then I can, stay sterile, but I can't actually, my hands themselves won't be. I can't stick my hands in that autoclave and still have my hands open. So the sterility is questionable, consider it contaminated. So anytime anything that should be sterile is questioned, okay? So one example is, let's say I set up all my sterile equipment here. If I turn my back, what happens?
Like your hair or something.
Yeah, you don't know. You don't know what happens. You could get hair on there, or a fly could come land on it, or somebody else could accidentally touch it and whatever. You don't know. So as soon as I turn my back on all my sterile instruments, they're not considered sterile anymore. You have to start all over. Next, let me see what we got. Okay, I'm going to show you guys kind of a sterile procedure and how that stuff works in a second, but I want to get through this first. Okay, standard precautions, and these are in the book, but we'll just talk about them. Because these are guidelines developed by the CDC, who's the CDC? Center for Disease Control, good, to minimize the spread of infectious diseases. Okay, sometimes, and you might write this to the side, but sometimes these are also called universal precautions. You'll hear these called universal precautions. Okay. It says all blood and body fluids are always considered contaminated. Okay, because you don't know. You don't know. You can't look at somebody and tell if they're HIV positive. You can't look at somebody and tell if they have hepatitis C. Now, if they get to a certain point and they're really sick, then sure you can. But people are walking around all over the place that are HIV positive, and you have no idea. So all blood and body fluids are always considered contaminated, meaning you don't ever want to touch them with just your hands. Obviously, that's just gross anyways, but even, sweat can carry some things, saliva, anything like that. Okay, OSHA, I remember who OSHA is. It's like a long time it's been. It was like the first couple weeks of school. So Occupational Safety and Health Administration. So OSHA is like the government agency or organization that actually oversees like health in the workplace for workers. Says OSHA established bloodborne pathogen standards that must be followed by all healthcare facilities. So these precautions have to be followed in all facilities, and they're good for these are, you would, if you go work, even at school, we have to do a bloodborne pathogens little in-service thing that Miss Murray always gives us information on. So it's for anybody. Okay, so personal protective equipment, or PPE, that's one of y'all's abbreviations for this week, isn't it? Maybe it's next week.
No.
And maybe on there next week. Anyway, it says healthcare workers are required to wear PPE when they may be exposed to any blood or body fluid. Okay, so if I'm going in there to do a procedure, like let's say I'm starting an IV, okay, is there a chance I could be exposed to blood? Definitely. Okay, so I'm going to wear gloves. If I'm giving somebody a bed bath, is there a chance I could be exposed to body fluids? Yes, there is. So I'm going to wear gloves. Maybe again, depending on what's going on. So those are just some. Anytime you think you might be exposed, you want to protect yourself. So this includes, and I'll have some of these rolling, try them on a little bit. This includes gowns. Now this isn't for every single patient is not going to need the same thing. If I'm going into someone to give them, a cup of water, I don't have to put on a mask and a gown and gloves unless they have something that's,
Really flimsy.
like airborne or something. But this is a gown. What'd you say?
It's really flimsy.
Well, it is. This was just prevent, from exposure. Okay.
Like with stuff not just see through it.
I know it shouldn't see through this one, but some of them, there's different gowns that have different, For some masks, whenever you guys get these out in a minute, these masks always have one end has metal on them, and you can actually make that fit around your nose. So it'll, if you've ever, that part always goes up at the top by your nose. And there's different kinds of masks depending on what you're doing. It can include shoe covers. Okay. They just fit directly over your shoes.
We get to pull in phones.
Head covers, depending on what you're doing. And then, of course, gloves is another type of PPE. Okay. Face shield is another example. Should have a face shield somewhere.
I don't see the camera on.
Oh, we will. In a few weeks. Here's another type of gown. And this one's definitely liquid proof. What was I looking for? Oh, face shield. Oh, that's part of it. Well, anyway, I'll show you this one. A lot of times masks, it'll be this kind of mask, but they have one of these plastic shields attached to the top of it. This is a face shield. That's like, let's say if I'm doing wound care or something where I'm using water to irrigate a wound and it might splash, this would be a reason I'd want to wear that, so it covers my eyes. Respiratory therapists, you'll see a lot of time wear these because if they're suctioning someone, that can cause splashing. You don't want that in your eyes. That would be gross. It says, choose the right equipment. You must know how that particular disease is spread. So if I'm going into someone's room, I should have an idea probably of what they have. Not always, obviously, in the emergency room, you don't usually know, but most of the time you do. So that will kind of determine what kind of equipment that you need. Now, if I'm cleaning up something I don't know about, then I'm going to take all the precautions necessary. So let's say, and that's kind of how a lot of times in the, one example, like in the trauma rooms, when I was working at Children's in the emergency room, they always, anytime they had a kid come in, because it was going to be quick, they didn't know what they had, you don't know what's going to happen, there could be, there could be a lot of blood, there could be a lot of body fluids, especially in that trauma area. So they would always wear everything. They would wear the gown, gloves, and a mask. Other than that, it kind of depends on what they have. Anyways, we have transmission-based precautions, and this is where we determine, depending on how a disease is transmitted, then that determines what exactly we need. So it says when these special precautions have to be utilized for a patient, the patient is said to be under isolation. So if they have some kind of special disease that requires that you wear a certain amount of personal protective equipment, then they're put under isolation. Okay, so it says that they're aimed at preventing the spread of highly infectious pathogens. So there's 3 types. We have airborne, droplet, and contact. And they sound just like what they are. So airborne precautions, these are used for diseases that are spread by airborne droplets. That means they're just in the air. You don't have to get sneezed on, you don't have to get coughed on, but they have tiny droplets that can actually remain in the air for longer periods of time. And actually, with airborne precautions, that mask isn't even enough. This type of mask is not enough for airborne precautions. You have to have a special type of mask. And the one that you use for TB is called the N95. And you actually have to be fitted for them. So like whenever I started working at Children's, I had to be fitted for a mask. So I don't know what size I needed. But these are a lot thicker. It's really hard to breathe through these. I think it is anyway. And they are the same way. They have metal on top so they can fit around your nose. But that's for like TB. What is TB? Do y'all remember? Tuberculosis. Okay, so that's the type of mask you would use for airborne. So typically, if you go into the hospital, there's going to be a sign on their door. If they're under one of these types of precautions, if they're under isolation, there will be a big sign that says airborne precautions. And right beside that, there will be a box of masks so that people can, they can go. They'll have them available. Because these pathogens can remain in the air for long periods of time. The equipment includes special masks with filters, negative pressure, and then negative pressure rooms. What that means is the rooms where you put people who have infectious diseases like this that are easily transmitted in the air, they actually are placed in patient rooms whose air does not get circulated back through the hospital. It actually goes out to like the outside of the hospital. So like at Children's, we had one particular set of rooms that were negative pressure rooms, and if we had somebody who we thought had an infectious disease that could be easily transmitted, we put them in those rooms because, we had kids on like the 10th or 11th floor that, were in there because they had cancer, and so their immune systems are compromised. Well, if we move that air around, with this kid sick and that kid's immune system is compromised, and all of these droplets can stay in the air for longer periods, we're putting them at risk. So it actually gets moved to the outside air, and then it gets dispersed because there's a lot more space. So, okay, droplet precautions. These are used with diseases that can be spread by coughing or sneezing on someone. So usually within like a 3 or 4 foot radius. One example of this is whooping cough. You know what the other name for it is? Start with a P. Pertussis. Write that down. Pertussis. 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 Y'all have everybody taken what's called the Tdap or the DTaP? I can't remember what it is right now. Tdap, I think. Probably had to take that one when you were 14 and came into high school. It's one of those shots you have to take.
I remember I took one.
Yeah, that one.
Tetanus, diphtheria, and pertussis. That's what the P stands for in that shot.
I love stuff.
Pertussis. So that's one example. There's some other ones in here too, but that's kind of like the one that you typically think of first. Okay, and then last we have contact precautions. So these are used when patients have some kind of skin or wound infection that can be spread by any type of contact. Okay, so typically with direct contact, so you don't have to wear a mask, okay, with these people, but you do have to wear gloves with any contact. Even if you're not going to come in contact with body fluids, you still wear gloves. And a gown. Kind of depends on what you're doing, but you're supposed to wear a gown every time you see them. So one example of this is MRSA that we just talked about, VRE. They're very easily spread. You know, you think about wearing a gown, it's like, oh, what if you don't touch them? But what if you, let's say you go in and they're like, oh, I need help going to the bathroom, and they can't get up on their own. So you go over, you lift them, help them to the bathroom. And what if they touch? Probably your hands, your arms, your clothes. And so now you've got all of that on you, whereas if you worn a gown, you could just strip that gown off when you're done and throw it away. Hand washing is the big thing and how to prevent this. Okay. Now with droplet precautions, I didn't say this, but you can just wear a regular mask because these are made so that those larger droplets that you would get with somebody sneezing would not fit through here. So anyways, just interesting. Why don't, we may do the sterile thing Thursday. Yeah, we'll talk about that. Y'all don't let me forget it though. So I want to let you guys learn how to put on sterile gloves. We'll do that Thursday. What I do want to go over really quick before we leave, I may leave all this PPE out, and I want y'all to put it on tomorrow. You'll have some time tomorrow. That assignment won't take you that long. But for now, let's talk about this project real quick for the last couple of minutes. Okay, so our hand washing teaching project. Now this is actually going to be a little bit more than just hand washing, but okay, it says you and your group will be teaching an elementary, or there's two options, and you guys can decide, you just need to decide probably before like Thursday what you're going to do. Option number one is it says you and your group will be teaching an elementary class about the importance of hand washing and infection, illness prevention. So how to prevent getting sick, basically. It must include an activity for the students, a teaching plan, and then some way for them to remember how long they need to wash their hands, like a song, something. It must include teaching activity, way for them to know how long to scrub their hands, like I just said, age-appropriate teaching plan, okay? So if you guys are going to be doing kindergarten, and I'll let you know as soon as I find out what age groups you guys are going to have, that's going to look different than 5th grade. Okay, so it needs to be age appropriate. We just talked about developmental stages and so forth. And then it says teaching on the importance of hand washing and the prevention of infection, including how to wash their hands and why they need to wash their hands. Okay, so they need to learn not just how to do it, but why, what's the purpose, and so forth. Okay, option 2 says you and your group will create a video instructing your peers, okay, so your age group, on the importance of correct hand washing procedure. It says please use age appropriate techniques, so statistics, blow germ activities, we'll talk about that later on. Make sure to include how long the hands need to be washed, how do we wash our hands. You could go into more detail for students your age, okay, versus a 5-year-old. They're not going to remember to wash every nook and cranny. Okay, so what you need to turn in. It says your teaching plan, including copies, scripts, whatever you're going to do, video, your script, kind of an idea of what you're doing, and all the materials you plan to utilize. Your first draft is due the 15th, so that's next Thursday. Okay, I'm not saying you have to have everything ready, but you do need to have an idea of what you're doing on paper to turn that in so that I can make adjustments. You'll turn in a group grading rubric. And then it says a presentation rubric to be filled out by the teacher in the classroom. And that's like our normal presentation rubric. I'll give you a copy of it. My plan is for us to do these on the 22nd. So you can write that down, kind of pencil that in up there, unless there's something going on at the elementary, which I don't know about. So kind of tentatively write that somewhere at the top. It's due January 22nd, but we'll try to go and do this. I have lots of stuff that you can do. Okay, hold on. Let's look at the grading. It So 25 on the back, 25% of it is the presentation rubric. So the teacher that is in the classroom, wherever you go and do your teaching, they're going to fill it out. 25% of it is the plan that you're going to turn in. And you can see age appropriate, whatever their creative activity is, hand washing, timing activity, it's easy to follow, and it's complete. I'll grade that on the 15th, that portion of it. Okay, and then 25% of it is the content. So is it accurate? Is your information that you're teaching them complete? Did you include everything? Hand washing, illness prevention, and then can they understand it? And then 25% is a group grading rubric. Okay. Now I have all kinds of stuff you guys can use. I've got some, have this other activity we're going to do on Thursday that you can use parts of that. I have, depending on what age group we do. I actually have a bunch of toothbrushes if you want to hand out toothbrushes. I have these, which are always good for younger kids, puppets. I have this book that's a really good book for younger ones to read too. You can do, you can have them dance, you can have them teach them motions. A lot of times people will make up a song so that it lasts the appropriate amount of time. It should last about 15 to 20 seconds for them to scrub their hands. Sometimes people just have them sing the ABCs, but I don't know, it's always kind of fun to make up your own song. You can do like a role play. That's always fun. Some kind of activity, something that's going to get them, involved and so forth. They're always fun. They've always got lots of questions for you. But the main thing that you want to do while you're thinking this is, you guys are the cool kids because they're little, you're in high school, they can't wait to be you. You're awesome. And so
You're awesome.
and so, you need to make sure that you portray that washing your hands and preventing sickness is really cool, and that's what everybody does because that's the cool thing to do, which hopefully that is the cool thing to do, and that is what you all do. But yeah, and that's going to make them want to do it. That's what you do to be cool. So, wash your hands. That's what you do to be cool in my book. So, but anyway, so that's, why don't we